I knew in school that I wanted to be an internist. So I went and got that specialty after I graduated. So it was very close to being a naturopath / chiropractic physician. So I was involved with stuff, other than necks and backs. And so my practice, when we started treating people, we've known this, we go straight to the gut. What's happening in the person's gut? And we knew about leaky gut 30, 40 years ago. We just didn't know what the name of it was. Now everybody knows about it. And I ran across this test years ago called string test, and it would allow us to measure the stomach acid, but it wasn't a very sophisticated test. But it allowed me, and that's when it started dawning on me when I started doing the test. Hey man, it's not too much acid, it's too little acid. So when I started dosing appropriately, I didn't have to go through such sophisticated treatment protocols, because when you straighten up when you pump the air in the tires and where they're supposed to be, the car actually goes somewhere. This is what it was. That's why I call it the missing link.
Hey everyone, and welcome. I am Morgan Gist McDonald, founder, CEO of Paper Raven Books. And today we are launching a super special book. If you have any concerns about your own health, this is going to be the book for you. The book is called Inside is Outside: How Stomach Acid Plays an Essential Role in Leaky Gut, and Why the Gastro Test is the Missing Link in Diagnosing and Treating the Root Causes of a Host of Seemingly Unrelated Symptoms, from chronic fatigue and pain to eczema and depression. Now, our author, who I'll introduce here, has practiced functional medicine for over 30 years. He is a board-certified chiropractic internist and advanced practice chiropractic physician. He developed the gastro test, which we'll talk about, which has revolutionized his practice and received a patent in 2021. He believes in educating patients on their journey to health so that they can be informed advocates of their own care. Dr. Tim McCullough, thank you for being here today.
Thanks, Morgan. I'm glad to be here.
So, Dr. Tim, the title of the book is Inside is Outside. What does that mean, and why did you decide to title the book that?
Well, it's about the gastrointestinal system, and it's kind of a unique way of looking at it. And I explain to patients that really the entire gastrointestinal system is outside of the body. And I say, what do you mean? It's inside of me. Well, not really. You have a hole in the mouth and a hole in the anus, and that's a tube that runs all the way through the body with a whole bunch of sophisticated machines with it. But when food goes in, it goes in there, it stays in that tube, which is outside the body, unless the body selectively takes it, breaks it down, and brings it across the margins inside your body. The rest of it stays as feces and waste and goes out. So I named the book Inside is Outside, so people would think differently about their digestive system, that just because you eat it doesn't mean it's supposed to go inside your body itself.
That is a total mind bender, because yes, any food that you put in your mouth could come right back out, except for the bits and nutrients and things that are pulled actually into the system. So that's crazy to think about. When people understand their digestive system in this way, how does that change what they choose to eat and drink?
Well, I get this all the time. I'm eating stuff that's natural. Well, mercury's natural, arsenic's natural, they're deadly poison. Just because what you're eating doesn't mean it's good for you. So your body has a mechanism to select exactly what it needs from what you put inside your tube or your digestive system. It's going to selectively draw and carry actively across the intestinal wall inside your body. The rest of it stays outside your body. The body should keep that out. When things start going inside the body that are not supposed to go inside the body because the cell wall is leaking, that's what leaky gut is, that's when the problems start. It shouldn't go inside your body. It should stay in the digestive tract, in the sewer system, so to speak, and leave. But when it starts going across, that's when you get all these complications. The body doesn't like things in there that it didn't select to be there.
I think this book is going to just absolutely change the face of people's personal lives and their own bodily health. I mean, what you're giving us in this book, Dr. Tim, is maybe at first glance basic physiology, but when you walk us through the implications of what it means to know how your stomach acid is involved in your overall bodily health, I mean, it's mind-blowing. So can you kind of walk us through, Dr. Tim, what is this book about? Who's it for?
Okay, the book is for just the patient. It's not really written for the doctors. All doctors, no matter what they are, whether allopathic doctors, which are the conventional medicine type doctors, or your naturopaths or chiropractic doctors that are more in the natural medicine, all of us study lots of physiology, and we know about hydrochloric acid and how important it is in the digestive system. And they also know the digestive system is the key to health. If you don't digest your food and get your minerals and your vitamins digested, doesn't matter how good the food is, you're not going to get better. And so this book is about touching a little bit on how important the digestive system is, but more specifically about what we've been missing in testing. We're diagnosing what we now call leaky gut dysbiosis, which is right now is one of the hottest things going on. When I started in practice, 35 something years ago, nobody even knew about it. And we made all kinds of assumptions that acid caused ulcers. Not true. Bacteria causes ulcers. But that we've kind of had that myth go forward that acid is the bad guy. Well, this test, when it finally got developed, we started using it. We found out that it wasn't too much acid, it's too little acid. And we talk about this in the book. And you say, well, why is that the missing link? Because we have all kinds of tests to measure very sophisticated stuff in your digestive system. We can measure the bacteria, the DNA of the bacteria, which kind of fungus, everything in there, but we're missing the one thing every doctor should be testing is, do you have enough hydrochloric acid? And the importance of that, which is the beginning of the digestive process in the stomach itself. And so many things go forward from the hydrochloric acid being correct. So many of the things spool off, the pancreatic enzymes and all this other stuff, yet we've never been measuring it. We've made assumptions for 50 years. You come in, you have stomach problem, you have some other things, you automatically have high acid. Well, it's not being tested, and it hadn't been tested. And we've been prescribing drugs to suppress acid for 50 years without ever having a test. And so we developed this test over many years, and now it has a patent, and now it's going to be available to the world. So if you have stomach issues or functional medicine issues, I get into that. What's functional medicine compared to regular medicine? Functional medicine deals with chronic fatigue, eczema, all these things that there's nothing for except we're going to give you a drug to cover it up or suppress it. How do you get to the core of this? Well, the core of that is to look at the digestive system first. And the very first thing to check, like checking the air in the tires of your car, is the hydrochloric acid. And now we have a test that patients can do in a doctor's office or practitioner's office that is so simple and so easy to use, and they can get information right there, and the doctor knows exactly what to do first, instead of saying, okay, well, let's just kind of chase our tail with this, trying to get this fixed.
Dr. Tim, you've been practicing medicine for over 30 years. And what I find so fascinating about your story is that you developed this gastro test out of necessity inside your own office. What kinds of patients were you seeing, and how did you kind of come across this idea that, like, wait, we should be looking at stomach acid?
When we go back, chiropractic, a lot of people don't know chiropractic has specialties. When I was in school, I wanted to be a naturopath / chiropractic physician, but back in those days, naturopaths are not licensed. And I've talked about this in the book, about how to find a naturopathic doctor. Weren't licensed in about 2 states, but chiropractic medicine allowed naturopathic medicine. So we combined the two. I knew in school that I wanted to be an internist, so I went and got that specialty after I graduated. So it was very close to being a naturopath / chiropractic physician. So I was involved with stuff, other than necks and backs. And so my practice, when we started treating people, we've known this, we go straight to the gut. What's happening in the person's gut? And we knew about leaky gut 30, 40 years ago. We just didn't know what the name of it was. Now, everybody knows about it. And I ran across this test years ago called string test, and it would allow us to measure the stomach acid, but it wasn't a very sophisticated test. But it allowed me, and that's when it started dawning on me when I started doing the test. Hey man, it's not too much acid, it's too little acid. So when I started dosing appropriately, I didn't have to go through such sophisticated treatment protocols, because when you straighten up when you pump the air in the tires and where they're supposed to be, the car actually goes somewhere. This is what it was. That's why I call it the missing link. And then we developed this thing, and it really took me about 25 years to get this thing done, and then finally go through the process for patenting and all that kind of stuff. So it's available now to everyone, which it wasn't years ago. There's a little known thing. FDA allows a doctor to do some work in their clinics for their patients individually that may not be on the marketplace. So this is how we do this. And we do this in our office a lot. I talk about that in the book about with herbs and different other medications. But leaky gut, quite frankly, is a core issue in chronic fatigue and chronic illness of just about any sort. And we talk about the multiple symptoms you can have from depression, eczema, and all these things coming from leaky gut. And the thing that no one is measuring in leaky gut is hydrochloric acid levels. And it is the absolute key. So this particular book is about, for the patients to understand, this is a very important thing. So when you go to a functional medicine doctor, the patient needs to say, I want this test. I want to know what my hydrochloric acid is, because why would I take all these vitamins and minerals if I can't digest them? And that's really true. Calcium, magnesium, which deals with osteoporosis, you can't digest calcium unless you have enough acid in your stomach. It's really a very important thing in functional medicine. And then the other side of the coin, in allopathic medicine, they really ought to do the test also before they give somebody an acid blocker. If you're already low in acid, and then you give an acid blocker, you're really creating a lot of nutritional problems that are going to pop up 10, 15 years later in some very serious conditions, because you won't be digesting your foods.
So there may be many of us who are watching or listening right now, but we have low stomach acid and we don't know it. If we have low stomach acid, and especially if we're taking acid blockers, what could be happening if we have low stomach acid?
Well, from a symptom standpoint, a lot of people have low stomach acid and then they get GERD or this reflux. And I talk about that in the book. Why does that occur? Well, on that one particular symptom, it occurs because the valves on the top of the stomach and the bottom of the stomach are really controlled by how much acid you have in there. If you don't have enough, the acid just keeps trying to mix, because it's not breaking the food down. And as it mixes, it squeezes a little bit of acid up through the top valve, which is supposed to be completely closed. And that's what causes reflux. Well, if you have adequate acid, it mixes and the valve on the bottom opens up and goes on in the small intestines. You don't have any reflux at all. So the new research is coming out. We know that to be the case. The difficulty is in our model, we want to find a drug to open up the bottom valve, which we can do that, but it also causes a lot of other problems. From our standpoint, we just get the balance of the acid correct in the stomach. You don't need a drug, and it'll open up on its own. So the other symptoms and all can really be, anything can cause anything. Everything from eczema to depression to fatigue. And I go in detail, not detail, but the book is written very in plain language. I wrote it for the average person. I didn't use big terminology. In fact, what the book is me talking to my patients for 30 years. Because I explained to them, hey, your gut's doing this, and it's got little holes in it. And when it gets in there, and it gets in the blood, then you start a war. And if you have a war every day, 3 times a day, pretty soon your body starts falling to pieces. And the book is kind of like that. It's for the patient. It's not for the doctors. The doctors already know about stomach acid. The doctors are the ones that don't know about there's a test out there they can use. They're the ones that truly want to help. I really want the patient, particularly in today's healthcare environment, they have to start advocating for themselves. And if you see the drug companies doing this all the time on TV, and they show somebody, you need this antidepressant or that or whatever, and they go to their doctors and saying, I want this drug. Well, I want the patients to understand that physiologically, this is an important test for them if they're going to a functional medicine doctor, because that doctor may not be aware that the missing link now can be found and they don't know about it.
So anyone who, you mentioned reflux already, you've mentioned chronic fatigue, autoimmune disorders, eczema, depression, like we may be taking supplements, taking pills, taking all sorts of things. Well, those may not be breaking down if we don't have sufficient hydrochloric acid in our stomachs. And the lack of hydrochloric acid in the stomach could be causing all sorts of other issues that maybe we don't even know about. And it sounds like it's as easy as going to a functional practicing doctor and asking for a test. You just take the test and right then and there, do I have sufficient hydrochloric acid or not? It seems like what you're saying is that's step one.
Pretty much it is. And now and I talk about it in the book and the type of test that you should have when you go to a doctor or a practitioner, nurse practitioner, or someone else that's, doing functional medicine. But there's certain ones you should have. They may want to do more tests and all, but what I'm saying is they now can know unequivocally without any question in their mind, this patient has enough acid or not. And you talked about vitamins and minerals. Early in my career, I wasn't measuring stomach acid. I would put people on tons of vitamins and they get worse. And why? Because they had holes in their gut and I'm feeding them with a bunch of vitamins and minerals, and it just made them worse because that's more stuff to leak through. I back way off of that now, especially so I know what the acid is. We correct the acid, we correct the pancreatic enzymes, let the gut start to heal a bit. Then you put all the vitamins and minerals in. Actually, I've seen patients get allergic to vitamins, taking them when they don't have enough acid, and they do get worse. So those of us that are doing functional medicine, remember, this is kind of new. I was back with some of the guys that just started this stuff years and years ago, but now it's getting more sophisticated and we got very sophisticated tests. We didn't have any of this stuff back then, but we knew that the body was malfunctioning. Now we're developing tools, including DNA testing and all kind of stuff in the gut. And this is just another tool that can be used. And it's so simple and safe. You have to stick a tube down your nose and give you an anesthetic and all that stuff. It's just simple in the office. 10 minutes later, boom, you got the answer. And in the book, I talk about 3 other tests that really should be done. They're very inexpensive and your practitioner can do that. The patients that have these chronic illnesses and problems like this, they really have a hard time finding someone to help them. And there's a lot of people out there that do bits and pieces, but they don't put all the picture together. And I'm trying to help too. The doctors that want to learn, I'll teach them what I know and the experience we have for 30 years. But this tool is tremendous. It's a tremendous tool. It's kind of like any other tool that really makes a difference, like blood work. Blood work's critically important. It's just kind of a new tool for the world to use. And I think that if we start measuring, if every doctor would measure hydrochloric acid, we would save a whole lot of suffering all around, because we wouldn't be giving drugs to people who shouldn't have drugs, and we would be supplementing ones that need the supplementation. And I've seen patients that are really strict on their lifestyle. They're not overweight. They don't eat Budweiser and strawberries for breakfast with chocolate cake, and all that, and they're sick. And what do we measure? Almost always, about 80% of these people don't have enough hydrochloric acid. And when you fix that good lifestyle they live really makes a difference.
I got to back up on that, Dr. Tim. You just said 80% of the folks who walk into your office with some sort of chronic condition have low hydrochloric acid.
Yes.
That blows my mind. Yeah. But it's so prevalent.
It's very prevalent. And you say, well, why would they have low acid? Well, there's numerous reasons. It can start with the diet, but you have to have the nutrients to produce hydrochloric acid. So if you don't have the right nutrients initially, then it doesn't start producing very much. And then you get into it's a vicious cycle. You develop leaky gut and you get bacteria in the colon, that's dysbiosis and all kind of stuff's in you. Then the whole thing turns into a mess. And you got to stop that process. And of course, I go back to my car illustration. You have a Mercedes sitting out there with flat tires. Great car, it isn't going anywhere. And the tires would be analogous to the hydrochloric acid, because that's the number one thing that happens when food hits your stomach. Hydrochloric acid breaks down the proteins, starts a process of digestion. There's something before that too with the taste buds, and I have a little bit in the book about that, but that's not the significant part of where leaky gut and dysbiosis comes from.
So if you guys are watching or listening and you're like, holy moly, I can't believe I've never heard about this. That's why Dr. Tim has written the book, and that's why we are promoting this book during its launch. We have the ebook for free right now. You can go to paperravenbooks.com/inside is outside, all one word. The link is next to this video. You can click that link, takes you straight over to Amazon. You'll see right there, you can download that ebook for free right now. If you know anyone, a relative, a friend, your own, kid or husband or wife who's struggling with something like this, do them a favor. Tag them in this video, send this video to them, get them a copy of the book. This might be the thing that they have been missing for years and just have not known about it. So go to paperravenbooks.com/inside is outside, download that ebook right now while you're thinking about it so you can read it later on the weekend. The book's available in physical versions too. So if you want physical versions, you can grab a copy at that same page. Dr. Tim, okay, so this is for patients. So patients can go and advocate on their own behalf. Like, please, can we check my stomach acid? Because I might be one of, millions and millions of people who have low stomach acid. We just don't realize it. And I know that your intention behind the book was really to present this information in a very approachable way. You said that from day one. You said this is for the patients, and this is about explaining it in a way that any person off the street can really understand their own physiology and advocate for themselves. Can you give us some insight into what this writing process has been like for you as a 30-year career physician to now writing a book? What was that like for you?
Well, thank goodness for editors. But really what I tried to do was the things that I tell my patients for 30 years, thousands of them, I sat down and tell them, okay, you have low stomach acid and it's causing leaky gut. And they go, what? What is that? And why is that related to this rash on my arm? And so I've actually made some videos early in my career back in the old VHS days, and I explain it to the patient. I want them to understand this is what's happening. And then when they get well, they still can't, I don't understand how did you work on my stomach and the rash went away, or I'm not depressed anymore. It just kind of blows everybody's mind because that's not the way it's done on TV. On TV, you take this pill and it's a magical formula. So the book was really kind of me trying to sit down with you, the patient, and explain to you how this is happening without getting really technical about every little molecule and this and that, but enough information to understand, and in a way that people could go, oh, that makes sense. Because you got to remember, I started this stuff 35, 40 years ago. Nobody had any clue what was going on in functional medicine. And we were kind of some of the pioneers, a group of us, but now it's just kind of blossomed. If you look on the internet, there's millions and millions of hits on leaky gut because people have figured this out, and practitioners have just expanded. Everybody's doing this stuff. So, but they're still missing the most important thing. What's the hydrochloric acid levels? Because without that knowledge for the doctor, I had a young doctor one time who came and did some stuff with me, and she went off on her own, and she said, I don't understand how you do this. My patients won't even run a $13 test. And I told her, that's because you don't understand how important it is. The patient may not understand, but the doctor has to know, I need to know this information, because I have an illustration in the book. When we give hydrochloric acids, and that may sound dangerous to people, but it's actually not HCl, it's another product. But this product, it's the dose that becomes important. Almost all the supplementation, and if you look on drugs, has HCl in it. Everyone knows about HCl. But when you start treating with HCl, the doctor needs to know exactly, not be afraid to give enough at the right time. So you take one pill, doesn't do anything. Take 2 pills, oh my gosh, this may be a lot. But when somebody has to take 6 or 7 pills, the doctor absolutely has to know, take them. And when the patient gets better, and they're not going to do that if they don't have a test to fall back on to say, I know what it is. It's X. And then we'll redo the test 3 months and see, are you getting better? And do you still need to take as much? So this is what we do. For example, in people who are being medicated for depression by a psychiatrist, they will do valproic acid levels or something in the blood to see if there's enough dose in the bloodstream. Well, we're doing this on a physiological level. We're not giving you a drug to make your mind work a certain way. We want to try to make your stomach work correctly. And if it takes 6 pills instead of 1 pill, that doctor has to have, or the practitioner has to have the confidence to know, yes, we're going to stick with this, or up it or lower it. And without the test, he or she cannot have that confidence. And that's what happened to this young lady. She didn't have the confidence to say, I have to have this information. And in functional medicine, and we talk about this on how to select the functional medicine doctor in the book, functional medicine is really learned after school. They don't teach you stuff in school, any school, chiropractic school, naturopathic school, a little bit. In medical school, out of the question. The doctors learn this afterwards. And a lot of it is experience. And my daughter, I've taught her this stuff over the years. She grew up with it, but she's doing it in her practice now. And she's learning every day, getting better and better and better. The good stuff, the good thing with the functional medicine doctor, they're not going to give you stuff that's going to hurt you. You know, we're not going to give you drugs and you're going to have a 2-headed baby or, you know, somebody 4 generations away, all that kind of stuff. The worst case scenario in functional medicine is it doesn't work properly, which in that case, the diagnosis isn't correct, and the treatment's not correct. That should be adjusted. Or you might dent your wallet a little bit, but that's better than damaging your body. And so we're after health to try to make you healthy, because if you're healthy, then the symptoms go away.
You mentioned something there, Dr. Tim, that I feel like was very important, like thinking of myself as a patient, for instance, you know, that you can take the gastro test, you know, we've already said that it's easy to do in office, it's cheap, it's fast, you have the results in 10 minutes, and that you can actually take the test, establish your HCl dosage, and then take it again. And like you can take it multiple times until you hit that equilibrium. And I assume that once you hit the equilibrium and then you start adding back in those supplements or that medication, that you're going to notice a more effective treatment with those chosen supplements or medication. Do you find that testing along the way is a useful way just to make sure that you're staying in the benchmarks that you want to be inside of?
Well, we're ultimately trying to get to where you don't have to take any supplemental acid. Okay, so now that depends on age, almost always with age. But on a young person, they will maybe take acid for 6 months to a year, and then they don't have to take it anymore, because remember, that vicious cycle stops. They start digesting their food. They start absorbing the minerals and vitamins, and then the HCl is so critical in making the absorption. Then they start making their own. So we redo the test typically every 3 months. It also allows me as a doctor to say, when should I introduce all these sophisticated nutraceuticals? Or is it just going to cause more problems? Because the gut is not closed up enough. We're not digesting our new food well enough. So we might do a test and say, well, we need to supplement a little more. So that's kind of the practitioner. It helps the practitioner make decisions. For example, say we did a vitamin D test on you, and 60 to 80 is where we want you. And you're 45, well, this is simple. Let's take some more. But if you do the test and you're 100, okay, quit taking so much. But if you don't do the test, how much do you take? So it's a guide that's never been available, especially so inexpensively, because there is other tests that you can measure acid, but it's a surgical type procedure, or another type of surgical procedure, or one that's an interpretation instead of a direct measure. This one, the reason why I was getting the patent, is because it's a direct measure of the stomach acid itself directly. It's not a radio transmitter that interprets, or it's not a tube where we stick chemicals in you and measure the differential stuff. This measures exactly what's going on in a resting state and also a challenge state. And that's critical. We talk about that in one of the chapters about the stomach acid barrier. And I think I've told you one time we were talking, in this COVID, a lot more people have died if they hadn't drank coffee. Coffee's an acid. All these people taking these, then the bacteria, that virus could go right through the stomach. It should be killed by hydrochloric acid. But if you don't have any acid, it go right in your stomach and you get infected. Well, when you've knocked down a bunch of coffee, you got acid in your stomach. It probably, the caffeine spurs the stomach to make hydrochloric acid. Coffee probably saved a lot of lives. And not that I'm advocating drinking a lot of coffee to get your stomach acid fixed, but it's just an incidental type of thing. People don't realize how critical this is.
Wow. So you guys, grab your copy of this book, dive into the world of how stomach acid could revolutionize your own personal health. Paperravenbooks.com/inside is outside. Dr. Tim, are there any, I don't know, words of wisdom or lessons learned that you have had, like your own personal revelation in writing this book? You know, is there anything that has occurred to you or that you've realized over this process of the book coming onto the page and now being, you know, launching and releasing into the world? Anything that you would say to maybe a younger version of Dr. Tim as a word of wisdom or an encouragement?
Probably would do it earlier. The response that I've had from, I still practice part-time, and the response I've had from my patients is just enormous, and they all want to read it. And I think it would be a good thing for the patients of any functional medicine doctor. Maybe do it earlier. I just didn't, I was so busy when I was younger. I didn't have time to do anything like this, but it's not as difficult as I thought. I mean, you sit down, write it down, and then you guys helped us out with editing and all that, which was good. Everyone's a little different. I kind of sat down, banged it out in a month or so. We had a little personal challenge going on, you and I, but I think if you did a little bit all the time, it would be good. And I think the advice you gave me was just write it. Don't worry about what it sounds like, just write it. And that's kind of what I did. I wrote it all down on the page of what I wanted to get down there and what I felt was important. And the process worked itself out.
Yeah, I think that's helpful for people to know. If you're writing a book, you know, that first draft is going to go through revisions and it'll incrementally kind of get better over time with each version of the draft. And so, yeah, sit down, bang it out if you can, and then it'll go through a process of refinement over time.
And one other thing is, this is so important. Me as a practitioner, it's important, but it's so important to my patients. And it's so important to people out there to know this, that I really felt driven to get the information out, because I've seen it change people's lives for 30 years. And I really think the rest of the country we can really improve the health of everyone by doing this simple thing and figuring this stuff out. It's kind of like the fart, you know, you just can't replace it. You have to know this information, and we've been doing without it. And it's not necessary anymore.
That's amazing. Well, thank you, Dr. Tim, for writing all of this down into this book so that we can share it out into the world. Thank you for all the work that you have done in functional and chiropractic medicine and the gastro test. So I truly hope that this is exactly what people need. And maybe they just didn't even realize that they were missing this gastro test and this understanding. Really, it's a whole understanding of how the digestive system works. And the digestive system, as you said, starts with taste buds and stomach acid before you even get into intestines and leaky gut and all of that. So yes, this understanding of the whole system maybe will help us all to have better health. So yeah, thank you for writing it for us.
You bet.
All right, guys, last chance. You're here, you're listening. Go ahead and grab a copy. Paperravenbooks.com/inside is outside, all one word. You can get that free ebook today. Download it on your Kindle. Tag anyone who you feel like maybe they need to hear this too. I know that they've had chronic issues or autoimmune or eczema or any of these sort of host of pain. Give them a copy of this book. It might just be the thing that they need. So thank you, guys. Thank you, Dr. Tim, and we'll see you guys next time. Bye, everybody.